Welcome everyone to the 25th webinar in the Governing for Reform in Aged Care webinar series. This one's titled Harnessing Risk Management to Achieve Better Outcomes in Aged Care. My name is Susan Staples and it's my pleasure to be your host today. Before we begin, I would like to acknowledge and pay my respects to the traditional custodians whose ancestral lands on which we meet today. I have the privilege of working and living on the lands of the Wurundjeri people of the Kulin Nation on the banks of the Birrarung, or Rivers of Mist, and also known as the Yarra River in Melbourne. I'd like to pay our respects to their elders past, present and emerging, and we acknowledge the deep feelings of attachment and relationship of Aboriginal and Torres Strait Islander peoples to country. We also obviously pay respects to the cultural authority of Aboriginal and Torres Strait Islander people attending from other areas of Australia, and welcome everyone here with us today. As I said, today's webinar is all about the importance of harnessing risk management to achieve better outcomes in aged care. It's a really changing aged care landscape that we're in, and managing risk is really fundamental to the role of governing bodies and executives. So we're going to draw on the experiences of the panel and use real-world case studies to really provide and help provide a practical understanding of how risk management can be used to drive innovation rather than limit decision-making. And we're going to explore how to use our risk appetite as a tool to inform decision-making and demonstrate how this leads to building a really positive risk culture, which is one of the fundamental parts of a successful risk management approach. For the webinar today, I'm really excited. I'm going to be joined by Sarah Blunt, Natalina Velarde and Justin Bealby, and we're going to get their perspectives on the benefits of proactively using risk management and, importantly, hear about their experiences as senior leaders in building positive risk practices into their organisation, which one of them more formally shortly. But before we do that, I'm conscious that while many of you are joining us today, you may have already been participating in the Governing for Reform program for some time. Others might be new to the program. So within the slides on the screen, you're going to find more information and a link to explore more details. You're going to find recordings from our previous webinars and information about opportunities to get involved in other parts of the program. It'll include some of the resources that you might like to access directly that are linked to today's webinar, which includes a topic guide on risk management, some past webinars and even a podcast, which are highlighted on the screen. We are really keen to make this an engaging discussion. So if you'd like to submit a question for the panel, please do so. There's a question and answer box on your screen. And we're going to aim to, get us through as many of those questions as we can throughout the discussion and throw to the panel members for their responses, given the time that we have with you today. I know that one of our presenters does need to leave a few minutes early, so we will try and make sure that we get everyone's questions through and get everyone's sort of answers as and when appropriate. I also want to acknowledge that today is Aged Care Employee Day, and that recognises and celebrates the dedication and hard work of a statistic I didn't know, but 370,000 aged care workers who support more than 1.5 million older Australians. So the day, which is celebrated on the 7th of August every year, has become a really important date in our calendars, and it does remind us of the commitment and dedication of our aged care staff. So really big thank you and an important day of recognition for the hard work that they do. So now please join me in welcoming our wonderful panellists for today. First of all, we're joined by Professor Justin Bealby. So Professor Bealby currently holds a number of board director positions, including the chair of the Eldercare Aged Care Board. And Eldercare Aged Care is a South Australian-based provider that delivers residential care and retirement living. Justin, for his sins, is also a board member of the Central Adelaide Local Health Network and the Deputy Chair of the South Australian Health and Medical Research Institute. He is an academic GP, an emeritus professor, and has long-standing experience and expertise in primary care and aged care research, health service evaluation, general practice, intervention studies and the translation of research findings into policy and clinical practice. So an incredibly well-credentialed guest for us today, and we're thrilled that he could join us to share some of that experience with us. I forgot to mention he's also the chair of the South Australian Ambulance Services Clinical Governance Subcommittee and chair of the Clinical Governance Spectrum Institute, which is a creative industries educational company. So really busy, and great that you could join us and find some time in that schedule, Justin. So thank you. Our second panellist is Sarah Blunt, and Sarah is the Chief Executive Officer at Kalira, who provide retirement living homes across Adelaide Hills and in the surrounding areas. So Sarah's career has really been focused on challenging ageism and enhancing the life of older people. She has a background in nursing and extensive leadership experience, which she uses to foster innovation and really help strengthen the ethical practices within the aged care sector. To that effect, Sarah leads the SA Innovation Hub, which drives collaboration amongst different providers and secures grant funding for really transformative projects across the sector. Her leadership at Kalira has led to significant growth and innovation initiatives, including co-locating a Montessori middle school within an aged care facility, really looking at that intergenerational care. And Sarah has also recently been part of the winning team for the Innovation of the Year of Intergenerational Social Engagement as part of that project. Importantly, Sarah has also held really key roles in national aged care organisations and has contributed to sector-wide reforms, which is driven by lived experience. And it's really wonderful to have Sarah with us today. Thank you, Sarah. Last and certainly not least, we have Natalina Velarde. And Natalina is a governance, risk and legal professional with over 20 years experience in education and human services. Natalina is passionate about encouraging good risk and good governance practices that really support and drive innovation and brings an ethical approach to business issues. In her current role as the Chief Legal and Risk Officer and Company Secretary of Villa Maria Catholic Homes, which provides aged care, disability and retirement living services throughout metropolitan Melbourne and regional Victoria. In this role, she's established and developed the risk function within Villa Maria Catholic Homes. So really great practical advice that we can draw on for today. Natalina is also a graduate member of the Australian Institute of Company Directors and a fellow of the Governance Institute of Australia, as well as a practicing legal practitioner. So again, really well credentialed and wonderful to have you with us here today, Natalina. Thank you all for being with us. So we're going to start the panel session and let's dive into this panel session with our panel. But before we do that, I'm just going to take the stage for a little bit longer. I just wanted to reflect a little bit on what I've been seeing in the sector, but essentially within the risk context. I've been a risk professional myself for over 20 years, and what I have seen recently is a real move from risk as something that is a compliance-led activity. It's can sometimes be seen as a bit of a handbrake or an admin task. And what we're seeing now is a real awareness and recognition that that's not the case, and that risk can actually be used as a really proactive tool to support growth, to identify opportunities and to innovate. But within that awareness and that raising of awareness of risk as an enabler, we're also hearing a lot of questions about, well, how do we go about this change? How do we go about bringing this into practice? And so where do we start? So I thought we'd start our first question to the panel, and maybe I'll start with you, Sarah, is to tell us about the journey that you've been on when it comes to risk management, moving from that more sort of compliance-led approach into a much more innovative approach. So Sarah, tell us about your journey. Oh.
With the AICD to do a complete GAT analysis with our board. So an analysis using their GAT analysis tool about what we were doing well and then how we wanted to work going forward. And at that point, we were a smaller organisation, I guess. We had a great big spreadsheet that had all of our risk management on it, and we identified that what we really needed to do was to lift to the next stage. So we went to strategy, we went to developing a risk appetite, and we decided to hold a board meeting every year that was completely focused on risk, because we weren't quite there for having a subcommittee at that stage. So that's sort of where we started the journey. And then we, after about another 4 or 5 years, we did another review, and that at that point in time, we established a governance, quality and risk subcommittee of the board, and the cadence of the board meetings started to change. So it's gradually evolved over the years. Of course, during that period of time, we had COVID come through. So we really ramped up our focus on risk. We ramped up our critical incident management plan and our business continuity plan, and that then took on a whole new level of expertise, and we grew the team in governance, risk and quality. So it's been a journey of growth. What I've really realised over that journey is that exactly what you were saying in the introduction. I've gone from thinking about risk as something I kind of need to control and nail down and comply with, to us realising that actually what framing does, and what having an appetite and the capacity to decision make does for us, is it enables us to take risks, because some of the things that we want to do seem quite risky. So, for example, when the opportunity came with the Montessori Middle School, which, popped up as an opportunity from someone visiting the site while it was being rebuilt and saying, gee, you wouldn't have space for not only my grandmother, but I'm a board director on this school, we were then able to embrace that, because we had a way of working with the risks that it posed in partnering. Because, of course, by then, COVID was coming along, and everybody under the age of 16 was considered a vector for COVID. So we needed to be able to work with that to make it work. Otherwise, I think we would have said this is too hard. So it gave us the capacity to embrace a fairly significant innovation. And we've been around for 132 years. And when I look back over the history of Kalara, it's the boldness to take risk and embrace change and do that in a sustainable way that underpins the fact that we've been here for so long. But how we've managed that has changed over that 100 years to where we are today with our risk management framework. And we will continue, and we'll continue to develop that. And we have grown our Help at Home.
I'm wondering.
Oh, sorry.
If that's okay. Sorry. You froze for a moment there for me, so I'm not sure if that was for everyone, but I might actually see if Natalina had anything to add, because I know that Villa Maria has been on a bit of a journey as well.
Thanks, Susan. VMCH, Villa Maria Catholic Homes, has also been around for a while, and in terms of our risk journey, I think the important thing to, I suppose, call out at the start is risk is sort of not a destination. It's a continuous improvement, continuous journey that needs to evolve and fit the circumstances of the organisation at a particular point in time. I've been with VMCH for about 7 or 8 years now, and so what was sort of appropriate at when I first started with VMCH, when they just sort of been through a merger, is quite different to what is appropriate now. The circumstances, the environment has changed, and so in terms of our risk journey, it sort of also needs to follow the strategy of the organisation. So over this time that I've been with VMCH, the board has also developed in terms of its maturity and risk maturity and approach. So we've been through a number of iterations of the risk appetite statement. Most recently this year, we've just completed it a couple of months ago and embedding it into the organisation. And as part of that, it enables the board to review where they're at with the risk appetite and therefore set the scene and set the tone for risk within the organisation. So we've been through a number of iterations and then reflecting that risk appetite statement through our strategic risk registers, and it's not just the register itself and that tick box sort of environment, it's actually looking at what the opportunities are. And the other thing around risk is it's not just the downside risks, it's the opportunities the opportunity risk, which is sort of a blue sky. You know, the downside risk is has a bottom to it, whereas opportunities that you miss are ones that enable the organisation to grow, I think, very much in the way that Sarah has identified.
It's like the risk of not doing something is
so
sometimes
I'll
worse than the risk of doing it.
Correct. That's right. So,
Justin, I'm keen to hear.
So, with a changing context, that's.
Justin, I'm keen to hear from your perspective as a board member, what risk journey you've seen and how the changes you've seen come through from a risk perspective in the organisations that you work with.
So Beth, Natalie and Sarah talked about the journey, and in the boards I've worked with, it's the same journey. Just let me go up to a board level. One of the important things for the board is to feel that risk is part of all the decision-making process and that the risk culture permeates through the executive team. The board needs to feel comfortable that risk management strategies is in place, robust, and being reviewed as it matures and grows. And the third and fourth thing, which is really important, is that risk is actually an incredibly empowering tool for a board with the information, particularly with innovation. We've been through, in all of the boards I've been on with, there has been a space where innovative decisions need to be made, or change processes, or growth. And what I've learned is if you've got a beautifully balanced board with the directors with a range of different opinions, and you do a brave and deep enough analysis around the risks, you will arrive at the right decision as a business and as a company. And the fourth one, which I think is the most powerful tool that I've seen used, is actually risk appetites that change and are reviewed each year. And I've seen a couple of boards where the risk appetite has allowed the differences between the executive and the board to be resolved regarding risk, whether it be financial or reputational or corporate social responsibility. That's the power of risk in bringing change and in driving innovation. And I think importantly, as a board member and a board chair, is linking the executive's risk tolerance. And you have to separate strategic from operational. Our job's not operational, our job's strategic, but there is an overlap. And I find that a powerful tool to say, well, executive feels comfortable about this area of risk, board doesn't feel comfortable about this, well, let's get a middle ground and make it come together from there. And then finally, what all the executives would argue is once you resolve the risk appetite, the risk tolerance for what the executive can explore and not waste their time on projects that are not going to be approved by the board, just becomes so much more efficient and so much easier. And that's the power of risk, to draw the company together, draw the organisations together. And in aged care, where there's so much change and a blend of risks, whether they be reputational, growth, quality, corporate social responsibility, you can actually have an equal playing field with shared thinking. And I think that's the power of risk to me. And that's what I've learned in all the boards I've worked on.
Thank you. I've heard a couple of times about risk appetite and the need to keep that up to date and keep that, mature and I guess relevant. And sometimes it's quite easy with those risk appetite statements to kind of, let's aim for zero risk on everything. Let's avoid as much as we can. We have a low appetite for risk in a lot of situations. I suppose maybe drawing on a little bit more on what you've said, Natalina, around the value of of the risk appetite statement from Villa Maria's perspective. What are some of the challenges that you feel a zero risk attitude can create, and potentially on the flip side where you might have seen some benefits of not taking that approach?
Sure. So I think there are very few things in life that are zero risk, I think, and definitely very few things in aged care that are zero risk. So the zero risk approach is probably not a realistic one and not a practical one. The approach is more around what can be tolerated within the confines of the operations, and again that goes back to the risk appetite statement. The approach we've taken here at VMCH is to change the language a little bit around the strict sort of risk management type of language to have identify things that the board finds totally unacceptable, those things that it finds acceptable, and then in the middle, what is tolerated. So the language is a bit more understandable from an executive and operations perspective to find that the area where the board is comfortable for the organisation to operate. And that's now being operationalised through our delegations. Again, a very important instrument that the board is able to use to identify things that it wants within its realm of where it's delegating its authority to within different levels. And using the risk appetite statement as a way of operationalising and making, and as I suppose a communication point to make sure the executive and managers understand that.
Thank you, Natalie. And I think reflecting also on what you've said, Justin, about aligning the board and executive expectations or appetites on risk has been really critical from your perspective. Have you seen where that has, or do you have examples of where that might have sort of played out well once you've nutted that out?
So some of the areas that where it's played out very well is the growth conversation and the business growth about what you actually and where your business is up to, whether it's residential aged care or retirement living or home care. You can start to unlock where the strategic positioning of your growth versus the operational risk of what you can afford to do is one of the areas that we regularly have an interesting, robust discussion regarding it. The second one for me is probably compliance. The issue around compliance, about where there is a significant pressure in the compliance space with aged care. The board sometimes is not as on top of that as much as the operational issues that go with that type of conversation. And probably the one that's surfacing for me is corporate social responsibility. This is beginning to become an increasingly interesting debate about how you focus with the environmental issues that we're all going to have to grapple with, and what's operationally workable and what board idealistically might want, but you can't do because we're not in that journey yet. So they're the three that come to mind very quickly, Susan.
Yeah.
Thank you, Justin. Keen, Sarah, to hear from a CEO's perspective, any reflections on that as well?
Yes, so I really confirm what Justin said. So it's not just the risk appetite, but it is the debate and the discussion and the shared thinking that goes into the development of that appetite that really has helped me be guided in this whole process. And then over time, because we review it annually, I've seen, IT was not a particularly big piece of it really when we started, but it's now a much, much more considered space around the risk around IT. That's really grown and changed over the years. And yes, I agree, definitely the environmental piece is really coming to the fore now. And the staff are interested in that too. They want to know what our risk appetite is. They want to have an understanding, because that then talks to them about the values of the organisation as well. So yeah, it's really important.
Yeah, thank you. And I think it actually addresses or potentially addresses a question that we have had from the audience around some of the risk areas, both strategic and operational, that are on top of mind for you in your role. So it sounds like there's a couple there that are overlapping. The other area that I wanted to touch on, which was also a question from the audience, is more around the processes, I suppose, of how you start to implement a risk appetite statement. And I know we've talked about, and Sarah, I loved your point about the importance of having an ongoing conversation, and Justin, you talked to this as well, is that the conversation is really important. And as a risk practitioner, it's always really sad when you see a risk register that's got dust collecting on it, sitting on the shelf, because people feel that that's what risk management is. You do an annual review of your risks and you check in once a year, when it is an active discussion and needs to be that. But the question from the audience is, how frequently do you review the risk profile so that it isn't set and forget in this changing environment? So what's your advice potentially? I'll start with you, Sarah. What's your advice around the frequency of looking at your risk profile and having these discussions?
So our clinical governance and risk subcommittee meet every 2 months, and we touch on it every 2 months, in fact, because the world is changing quite rapidly at the moment, and ensuring that those top 5 risks that the board are focused on are absolutely relevant and nuanced to the changing environment is a really important piece. And that's taken up a lot of the time that we debate at those committee meetings. So a living document,
Yep.
Absolutely.
And yeah. Justin, from your perspective as a board member, how often are you looking at the risk profile, or is your board looking at the risk profile and having these risk discussions?
I think it depends on the level of risk. It's probably the key thing we haven't talked about here is whether it's high, medium, or extreme. I mean, the extreme risk would be part of our every board meeting. We actually need to know we've got an extreme risk with a couple of boards I'm on, and they're talked about at every board meeting. I agree with Sarah that the real value of risk management and review is it's a living document. It changes. I have been on boards where the documents still has a owner who's retired. Now, that's just not effective management. And I think the issue, if you make them living, each audit and risk committee, which I don't chair, one of the other directors chairs, they look at the risks and review them. The extreme risks come to the board. The board says, okay, what's the controls in place? Who owns, particularly the owners? It's really quite a crucial issue. And the more you use them as living documents, and I'll get to something else in a minute, the more that they become part of culture. And the thing that we haven't talked about is, I think risk should be owned by every employee within aged care. It should cascade down and up, and not be sitting at the executive in a sort of a piece of paper that says X, Y, and Z, or these are the risks. Basically, it needs to be embellished right through the organisation, from the carers right through to the board. And I think that's the growing realisation of the power of risk and the issue to report upwards with issues that are surfacing. So it's just an evolving, growing, and such a positive element to what you're doing as a business.
Yeah, thank you, Justin. I think risk culture is absolutely the glue that holds a lot of the practices together. And I think there's a role for the board to set that tone, and there's a role for the executives and obviously people in the risk function in the organisation to really live that culture. Natalina, I was going to ask, from your perspective, obviously as sort of someone who's charged with trying to implement a lot of this within an organisation, what are some of the lessons and challenges that you've learnt in embedding the risk practices and changing risk culture?
The risk culture sort of starts from the top, and having the risk appetite statement reviewed annually is important. But having discussions around risk and interplayed with the strategic discussions is also important. The framework is embedded throughout the organisation. But the culture of the organisation also is one where I've found we have a very open culture. We've had risk is talked about, and safety and clinical risk is talked about from orientation through to operations. We have checks and balances in place to ensure, so the audits that the quality team does to ensure that the risks are identified and come up through reporting to different committees up to the organisation. And we really live our values of being courageous in reporting and identifying risk and not walking past safety risks, for example. So everything we do in terms of coordinating the activities through safety and quality and risk, sort of the central function, are all sort of really important in promoting the risk culture, both at operations and then and then set by the board, and so live through the reports that are coming to different committees. So we also have a process where the major risks or the high risks are allocated to different board committees, so they have oversight, and the executive who owns that risk has to report to that committee on that risk and what mitigations are in place and how that is moving over time. And the other element that sort of came to me in terms of the discussion that you was having before is when the board talks about a strategic item, risk is embedded in that discussion as well. In terms of, so we have a formal, the formal frameworks of bringing risks to the board or to the various committees, but also at the board level. Now, in terms of challenges, obviously, as I said earlier in one of your other questions, the risk and the identification of risk and the culture changes over time, and that journey has been a continuous one, and it's a constant reinforcement. I think it's not a set and forget. That's the challenge of ensuring that risk is discussed, whether overtly or not, in the way in which issues come up through operations and then to the board.
Yeah. I think one of the things I've seen from that perspective, we're talking a lot here around how do you bring it into the conversation, how do you bring it into your structures around board meetings and committee meetings. I think for me, there's an element of how you even use your agenda, practically use the agenda as one mechanism to make sure you can bring risk to the conversation more frequently. But then it's much more a mindset about what are the risks and opportunities around this? What is our appetite for this? And really actively bringing that into the conversation. It's actually a nice segue into another question from the audience, which is talking again about risk appetite, but how do you practically implement and embed a risk appetite as part of decision making when your organisation may not have all that mature a risk process? So sort of where do you start and how do you start to build this out, particularly from a risk appetite perspective? And Sarah, I might throw to you to start us off with that one. Thanks.
Yep. You mentioned the agenda. So on our board agenda, I make a declaration around various elements of risk right up at the beginning of the meeting. But we also, really small things like into our project frameworks and any document that someone wants to perhaps put forward to the exec or the exec want to put forward to a committee, we have a standardised sort of decision-making framework, and risk needs to be addressed in that. And when we started doing that, people weren't sure how to go about that. So that then enabled us to have coaching conversations and talk about having a risk appetite and having a risk framework. And again, that is a really ongoing conversation, because when I think about those conversations and what we wrote in those papers, 5 or 6 years ago compared to now, we're much more sophisticated now, and I'm sure in 10 years we'll be even more so. So that's just a really small but practical way we do it.
Thank you.
Just to build on
Justin?
Sarah's conversation. Just to build on Sarah's conversation, there's two things or three things I think I'd like to add. I think that importantly, building an integrated risk management strategy or getting some help to develop that risk appetite is part of that conversation. So you need to make sure the strategy is in place with governance, measurement, agenda setting, appropriate. So you build the strategy, and sometimes you need some external help to do that with people who are very skilled at this type of work, and that's something to think about. Secondly, I've done a number of risk appetites now, and you have to spend a day at it. You have to sit down and stop and work it through for a day with the executive and the management, particularly where there's differences of opinions. And I think you need someone who's an external person to help sort of balance that discussion. I think it's very difficult to do internally because of the different perspectives. And then thirdly, I think it's really important to me is that you agree to review it every year. That you go back and look at it again and you review it again. So the question's a very good question, but it's part of a journey. It'll take 2 to 3 years to settle down, as Sarah's outlined beautifully with Kalara. So, and I think you have to start the journey somewhere and accept that it's going to take 3 or 4 years to settle, and just enjoy it. Just learn from as you go along and not try and get it right on day one.
I think from my perspective, and Natalina, really happy to get your views as well, but my perspective would be you've kind of got to bust a couple of myths about risk and what it is and what it isn't, and just build some confidence in having a conversation. And sometimes, like we've discussed, sometimes that's just about the language that you use. Like, yeah, we are operating in a risky environment. There are things we need to trade off. There's tensions we need to balance. This is all it is. It's a conversation about that and putting some structure around it. And a risk appetite statement feels really formal, but it's actually just acknowledging where and when we want to take risk and what we want to trade off, and what's our walk away on some of these things. Natalie, and I'm really keen to get your views on this as well.
Risk is part of everything we do. Before we had any structures, people were sort of doing it inertly in sort of running home care or residential aged care. You know, it's what people do, what risk frameworks do, and it is to set some parameters and around that, but also make sure that you're not missing anything. And the risk, at the pinnacle of that, the risk appetite statement allows the board, and I certainly saw it in our process, it allows the board time to have a conversation. And we had workshops outside the board meetings over a period of time, gives them space to talk about issues and where they see their decision making, and where they, have those conversations which are not, that you don't have space to have in the formal board meeting. And to revisit that annually is really important, because things change so quickly in our sector. They change from month to month, and it allows the board that time to reflect, and therefore sort of set that tone continuously as in that time frame, and not become stale. I mean, things change all the time.
Yeah. I'm keen to hear, and maybe Justin, keen to hear from you again from a board's perspective, but what are some of the initiatives, I think you alluded to them before, but what are some of the biggest benefits, I suppose, that you've seen from taking this more proactive approach to risk?
Just before I do that, I think one of the things we haven't talked about is workforce, that employing people who actually understand risk management. And I'm lucky enough to work with a couple of boards with outstanding risk managers. And I sense workforce is sensitive. I get all that in our sector, but sometimes you've just got to step back and say, we don't have the skills around us. Let's bring someone in that can help us work it through that for a couple of years. Just don't underplay that as an issue, which is important from there. So I think that's the first thing I want to say, which is important from there. Just go back to your question again. Re-ask the question, Susan, while I frame it. I just want to get that issue around workforce out. Just re-ask the question.
Yeah, sure. It was really where you've seen some of the biggest benefits to your organisation from this more proactive use of risk. Yeah.
I'm going to give a negative and a positive example. I've seen some boards, some boards where risk wasn't put on a project, and you might have guessed it was a business imperative project, and risk wasn't done deeply enough to actually analyse the problems, and turned out to be a difficult issue that took a long time to resolve. So if you just bring a business growth and a strategic conversation without a risk conversation, then you're missing part of the story, which is the bit I've learned. The second part of the conversation, though, is when there's been bigger projects where significant decisions have had to be made. And the bit that I like about that is if you have a beautifully balanced board, which I'm sure we all have, and you have a diversification of opinions, everybody needs to be able to get to the point of agreement, and each of the views need to come to the table. And then I think you then eventually make the right decision. And we've made some significant decisions with a couple of boards I've been on, which have been a shift in where we're going. But it's that balance of the board, balance of opinions, and doing a deep enough dive to get the difficult issues out early and not hide them as you work through risk. And that's the bit I've learned about what's the projections in 3 years for growth, what's the projections in 3 years for quality, what's the projections for 3 years strategically, and having the difficult conversations and taking time. The more significant the decision, the deeper the risk analysis is the bit I've learnt over the years. And I think that's the bit that's as a board, that's our board role. And I really enjoy it when you get consensus. You suddenly reach a point where everybody agrees, yes, this is the right thing to do. And yet all the onion layers have been unlocked. That's a long-winded answer to your question, Susan. I hope that clarifies what you want from there.
It's great, because what it's leading to for me is a question around the outcomes, essentially. And you mentioned before the importance of being transparent in the risk reporting. I think one of the things that we often see is lots of everything's okay reports, when actually from a board's perspective, you want to know where things aren't okay so you can be proactive about managing those risks. And in particular, my question was going to start to focus on how has risk benefited older Australians? So where have been the biggest benefits for the people that you care for through taking this risk approach? And in that context, maybe Sarah, this is a good question for you. I guess the approach that we're taking around openly discussing risk, raising issues, being transparent, how has that impacted on the care that you've been able to deliver?
That's a big question. So yes, so we have a very open and transparent organisation, and that has been and is challenging at times, because that means the conversations we might need to have with the resident, with the family, are really getting down to the nub of what we can and can't provide in terms of care, and what it means, and what risks a person or a family might want to take versus the system in which we're working, and the constraints of that. So, and I think that with a human rights piece of legislation coming in, that's very much focused on the individual, but a very tightly regulated system, we are going down a process where that is going to start to come together more and more. And that is the challenge going forward. And that is why we need to be able to articulate risk, and we need to be able to be brave about what it might mean, and balance that dignity of risk for the individual versus the system in which we're in and what we can and can't do. So, yes, it's a very interesting time for us, I think, in this sector.
Absolutely.
Do I think that it
Madalena,
has certainly... That's right.
No, go on.
No, that's fine. Yeah.
Madalena, I was just going to bring you in and sort of see if there's any examples that you've got about where the initiatives that you've put in place through a risk approach have really benefited the people that you're caring for.
An organisational perspective, having the culture of reporting has meant over time that the quality of the reports are better. And whilst that's reports in themselves don't create better care, the culture behind that is what is creating the better quality of care for the older Australian, in terms of if people are aware at the operations level of issues, then they're being followed up, and up the line managers are making sure that they're being followed up and reported up, then that's the culture that creates a better quality of care for older Australians. So in itself, it sounds like it's a report, but really what it is the transparency of the culture, and ensuring that things are identified and people aren't scared to identify the issues and to report them up, which is really at the core of the frameworks and the reports and the culture that is set at the board, percolating down to the front line. Because at the end of the day, risk culture and the risk framework needs to make sure that the old Australian does benefit. So I'd sort of identify the fact that having the transparency of reporting has meant that people are getting better care.
And I wonder, you talked about empowering the frontline staff to manage risk. Has that helped, that I guess, search for transparency and that requirement to be more transparent? Do you think that's helped staff to be empowered around managing risk?
I think it does. I think that if you are confident if people are confident that that the repercussions of reporting are not, that you're expected to report and to manage risk, then that does empower staff to be able to take the initiative and ensure that things are done safely and are followed up, and then they're not left to be proactive to manage issues as they arise. So yeah.
Yeah, thank you.
So,
and Sarah, again, I know you wanted
So
to
we
say.
have. So I suppose we've got. Yeah. That's right.
Sarah?
Okay, so yeah, so we have done quite a bit of work with the staff around dignity of risk, and enabling the people who we deliver services to be able to define their own risk tolerance, if you like, for things. And I guess one of the things that comes to mind was my mother was in a memory support unit, and when she first entered into aged care, like many people who had been at home for a while, her quality of life and her health really improved because she was better hydrated and she had better nutrition and she had support and people around her. But eventually she progressed in her Alzheimer's disease, and she was in the memory support unit, and we noticed that the staff noticed she was starting to lose weight. And that was around the time that we first came in with the measures that everyone needed to be weighed on a regular basis, and that the tolerance for weight loss was very low from the greater system and the commission. So so that was okay. They said, we'll put her onto a high calorie diet and that sort of thing. And then I noticed that she was, seemed to be suffering from indigestion, rubbing her tummy and a bit burpy and all that sort of thing. And she, and where the weight, something wasn't quite right. So we had to have a conversation about, is this high calorie diet right for my mum? And is she better off for it, or is she not? But what does that mean if she then loses more weight when we've got this new measure about weight? So that became a really challenging conversation, because the system drivers were pushing to keep maintaining her weight, but we were alerting to, we didn't think that it was really working in that way for her. Now, we resolved it, but I think that those are the little things that impact quality of life, where the dignity of risk and choice and understanding really become a challenging conversation, and empowering staff to pick up on those nuances and then to be able to have a conversation with them or take them to those who can is really critical going forward as we get more and more system-wide measures coming through. So, yes, and I think the dignity of risk conversation is something we have to revisit on a regular basis.
Yeah, thank you.
And
I think it's also that reflection. It is. I think the reflection is that the empowerment of staff at the front line to really understand where that risk appetite sits, what the approach to taking risk is, and where it's important to lean into it, and where it's, where is that hard line, is a really important reflection, but also just understanding that it's there to support the delivery of care. It's not there to be an admin task. It's actually there to provide better outcomes. I am conscious, Justin, that you'll have to leave us shortly. So I was going to just ask if you could give us, I guess, some 3 sort of takeaways from you around how you can harness risk management to really achieve better outcomes. We've heard a couple of things from you already, but if you had 3 sort of, here's the 3 things I'd like to leave you with, the floor is yours.
It's kind of you. Thank you very much. So I think you need a robust management framework that gets assessed and built adequately. I think that's really important. Secondly, I think you need staff who are skilled in this space to work in this space, as I've said earlier. And thirdly, and I'll finish how it improves healthcare, I think the value of risk appetite, setting the risk tolerance for management from a board level, allowing that freedom and using risk to deal with difficult problems to get consensus is the bit I've learned over the years. And to final question, you didn't ask me about health and outcomes for clients, but I think our board and the many boards I work on, as you know, picks up safety and wellbeing as part of core business. It's not just financial and and business continuity and business growth. Safety and wellbeing is part of all of our conversations. Goes back to what Sarah and Natalie have just said, is as we move to tailored person-centred care, I actually think there's a work in progress going on between staff from the bottom of the organisation. That's not meant to be negative, but from all the way through the organisation, understanding what risk means for person-centred care. We've got a journey we're on, and that's the bit that's exciting. Once the framework's built, the appetite's working well, the board and the executive are aligned, I think you're in a good space to move forward. So, Susan, that's my little bit of final comments. So thank you very much. It's been a pleasure.
And thank you very much for joining us. I'm aware you do need to drop off. So, yes, thank you, and feel free to drop off when you need to go.
See you, Sarah. See you, Natalie. Cheers.
Natalina, what are your sort of 3 top tips for harnessing risk management within that context? We've had some great insights from Justin. What would be your 3 top tips?
So, first of all, I would say that a risk appetite statement is a good tool for the board to ensure that they take the time to review and set that tone from the top, so to speak, regularly, but also to make sure it's set out in language that talks to different levels of the organisation, so it can be operationalised, first understood and then operationalised throughout. My second one is just to sort of say that sort of the way I started in terms of that risk management and frameworks, and it's not a destination, it's a continuous journey. That sounds a bit trite, but it needs to be adapted and evolves in the way that our context and environment evolves, and needs to be constantly reviewed so that it meets the needs of the organisation at a different point in time. And so as things change, things need to be tweaked and adapted. And the third thing I would say is that the real benefit of risk management and frameworks is to identify the upside of risks, not just the downsides. The downsides are obviously very important to identify because they have ramifications on our operations, but the upsides have so much more potential and create a lot of excitement and are really critical to the ongoing continuing operations of the organisation, and that's where that really comes to the fore. So they're my three.
Wonderful. Thank you. Sarah?
So for me, I think I agree very much with what both Justin said previously and our previous conversation. For me, it really comes down to the dignity of risk, and it comes down to enabling people to take risks well and in an informed manner, rather than what we talked about right back at the beginning of locking things down and avoiding risk. So that's what we want to do. That takes real diligence. It takes courage, because you have to have some pretty confronting conversations at times, because people do have very different risk tolerances, and being able to align that takes for a frank and fearless conversation. But it does give rise to that living conversation and the living risk appetite understanding that gives you long-term sustainability. So I think, they're my top three.
Thank you. Yeah, thank you. Look, my reflections on today's discussion, and maybe it addresses one of the other questions that we have here around, operational versus strategic risk, but I think there are certain things that need to be considered from the top down. So when you're thinking about risk and risk frameworks and the usefulness of risk in that context, there is a separation of what's happening within the front line and what's happening at the top of the organisation from a framework perspective. And we've heard a lot about how the framework is really important, but also the discussion and the transparency and openness of the discussion is hugely critical, and to not be frightened of having a conversation about risk, even if it might mean that they have to be difficult conversations or you have to front up on something not working quite as well as you wanted it to. So your reporting transparency is really important. But I really love that comment that I think, Natalina, you were making about it's not a destination, it's ongoing, and it needs to continue to evolve. And these embedding and changing risk culture through things like a risk framework, having discussions around where you can and can't take risk, looking at where you're exposed on a frequent basis. All of those things are essentially what we do, but this just puts a bit of structure around it and hopefully allows people to reflect more around what's coming rather than what fires need to be put out. So I think and hope that that's been a really useful reflection for everyone who's been able to join us today. I am conscious of the time, so I'd like to maybe wrap this up and obviously thank everyone who has attended for joining. We will have, following the session, an email that comes out to you with a link to provide you with, or to provide us with, some feedback. We'd really value if you could take the time to complete that survey, because we do love to hear from you. As mentioned earlier, if there is more information about the program or you want to access any of the other learning materials, there's also a link on the screen that you can access some of those activities, and a reminder email for this event as well. But yeah, please share the post-webinar content and video with your network. It's going to be up recorded, and the webinar will be made available to you. So once again, yeah, thanks, Natalina, so much for joining us. Thank you, Sarah, for joining us. I know there might have been some delay in some of the technical side of things, but really appreciate your patience and absolutely appreciate the words of wisdom and sharing what you can with us today.
Thank you.
Thank you.